Welcome to Endo Battery Fast Charged, a series dedicated to keeping you informed and empowered in the realm of endometriosis. Teaming up with board-certified patient advocates, we bring you the latest articles, research, and insights to equip you with accurate information and a deeper understanding. Whether you're expanding your knowledge, staying updated, or seeking clarity, you're in the right place. I'm your host, Alana, and this is Endo Battery Fast Charged, charging and empowering your life with knowledge. Welcome back to Endo Battery Fast Charged, your quick hit of clarity, validation, and grounded science. Today, we're taking a rapid but meaningful tour through several articles that scratch at a question so many of us have lived long before the research ever caught up. Why does endometriosis seem to overlap with so many other conditions? And why does it affect the whole body, not just one organ? Before we get into it, I need to make something abundantly clear. Correlation does not equal causation. These studies aren't saying one thing causes another. They're exploring patterns, biological pathways, and shared mechanisms that may someday help us understand the lived experience patients have been reporting for decades. This conversation is about curiosity, connection, and empowerment, not panic. So, without delaying this any further, let's jump into it. The first article we're going to explore is titled The Potential Connection Between HEDS and Endometriosis. All right, let's zoom into this somewhat old but still interesting 2022 study that explores the potential molecular soap opera between hypermobility, Ehlers-Danlos syndrome, or HEDS, and mast cell, the same immune troublemakers that keep popping up in endometriosis conversations. If this title sounds like a mouthful, don't worry. I'll unpack it in plain terms. First, the basics. HEDS is a connective tissue disorder. Think stretchy joints, hypermobile, flexible skin, and ligaments that might feel a little too floppy. This isn't just an issue of being bendy. In HEDS, the very scaffolding of the body, collagen, the extracellular matrix, is a bit different, and that may change how other cells behave. Now, what's the study actually about? Well, the researchers looked at how mast cell might be chronically overactive in people with HEDS or hypermobility spectrum disorders. Mast cell, as you might remember, are immune cells that release histamine, tryptase, and cytokines. Basically, they sound the alarm and stir up inflammation. In HEDS, their mediators, those molecules mast cells release, may be contributing to tissue-level disconnects, altering how connective tissue works and possibly making things like pain, instability, or inflammation worse. Here's where it gets messy or interesting. The authors propose that because the connective tissue is more fragile or elastic in HEDS, mast cell activation, the repeated degranulation, could lead to persistent inflammation, which in turn could damage tissue or at least make them more reactive. That could theoretically play into how things like pelvic pain develop. And sure, some people with HEDS also report endometriosis. There are estimates from other sources that 6 to 23% of people with EDS may also have endometriosis. But, huge but, this correlation is not causation. The study doesn't prove that HEDS causes endometriosis. What it does do is suggest a plausible biological mechanism. Mast cells already being more trigger happy in some HEDS folks might exacerbate inflammatory loops, influence fibroblasts, cells that rebuild connective tissue, and generally make connective tissue more volatile. There's also talk in the broader literature about extracellular matrix, or ECM, remodeling, being dysregulated in EDS, which could affect how lesions, like endolesions, stick, invade, or persist. Though the authors of the 2022 paper don't fully map that out. So what's the takeaway? This study doesn't drop a mic with HEDS equals endometriosis, but it does supply a thoughtful piece of the puzzle. It supports the idea that mast cell activation, or MCAS, in HEDS could contribute to chronic inflammation, which might worsen symptoms common in both HEDS and endometriosis, like pain. And importantly, it points out why multidisciplinary approach, gynecologist, immunologist, rheumatologist, is so important for people navigating both spaces. In plain words, we don't have a smoking gun, cause and effect yet, but we have good leads. Mast cell may not be the bystanders. They could be the amplifiers in the discomfort loop connecting HEDS and endometriosis. Future research could drill into whether targeting mast cell activation might one day ease symptoms for people with both these conditions. As we continue with this trajectory of research, we're going to dive into an article that is brand new, but also not brand new, about mast cells and endometriosis, titled Mast Cell Mediated Epithelial Mesenchymal Transition in Endometriosis. That is a mouthful. And before you panic, no, you do not need a PhD, a microscope, or a secret decoder to bring in understanding this. I'm going to keep it simple because science does not need to feel like a tax audit. This study looks at something called the CCL2 or the CCR4 pathways, which, yes, absolutely sound like a droid from Star Wars, but I promise it's just a communication channel that mast cells use. So here's the deal. The idea that mast cells are involved in endometriosis, again, is not new. Mast cells are basically the drama queens in the immune system. They're cells responsible for allergic reactions, inflammation, the whole body doing the most experience. We've known for a while that people with endometriosis have more active mast cells. And older studies and even animal models have shown that when you calm these cells, endolesions grow less. So the concept that mast cells play a role, been there, seen that, bought the t-shirt. What the study adds though, and this is where it gets fun, is the mechanism. Instead of just saying mast cells are here causing problems, the researchers zoomed in and said, okay, how exactly are these little immune gremlins stirring the pot? And what they found was that mast cells appeared to help push endometriosis lesions into something called epithelial mesenchymal transition, also known as EMT, which is much easier to say. Now, EMT is basically where cells stop acting like well-behaved, tidy little epithelial cells that stay in place and instead start behaving like mesenchymal cells, which are more mobile, flexible, and frankly, a bit too ambitious. The cell equivalent of someone deciding to quit their desk job to become a traveling circus clown. The CCL2, CCR4 signaling pathways seem to be the walkie-talkie connection mast cells use to nudge endometriosis cells toward this more aggressive behavior. So instead of just sitting quietly, these cells get the message, literally, and start becoming more invasive, harder to remove, and more persistent. If you've ever wondered why some lesions act like they've unpacked their suitcases and moved in forever, this kind of signaling may be part of that reason. Now, does this change everything we know about endometriosis? Not quite, but it does give us a clear picture of what's happening on the microscopic level. Kind of like turning on the lights in a messy room. The mess was always there. Now we're just understanding which pile came from where. And importantly, identifying these communication signals make them potential targets for future treatment. If we can block the mast cell messaging or reroute them, we might have new ways to slow lesion progression or reduce symptoms. So, in short, this research doesn't overturn the mast cell story, but it does add meaningful detail. It's like adding subtitles to a movie you've watched 100 times. You suddenly catch things you didn't see before. And for a disease that has been misunderstood or under-researched for decades, clarity, even in small pieces, matters. All right, to round out the mast cell world tour, let's talk about this article from the EDS clinic that breaks down how endometriosis and the immune system basically get into each other's business in messy, dramatic ways. The article titled The role of mast cells in endometriosis explains that endometriosis isn't just a pelvic disease. Nope, it's more like an overachiever of inflammatory conditions affecting hormones, immune pathways, gut function, pain processing, and the general, why am I like this experience? So if you've ever felt like endometriosis is a full body event, congratulations, you're not imagining it. One of the big stars here, again, is the mast cells. Think of mast cells as immune grenades waiting for a reason to go off. The article explains that endometriosis can activate these cells, and once they're activated, they release substances like histamine, prostaglandins, and cytokines that basically scream inflammation time, and that can turn up the volume on pain, gut issues, bladder dysfunction, fatigue, and that foggy someone unplugged my brain feeling. This is why people with endo also experience symptoms that look suspiciously like histamine intolerance or mast cell activation issues. But the article also makes another important point. Estrogen is not helping. Estrogen stimulates the growth of endometriosis lesions, increasing inflammation, even influencing the mast cell behavior. So now we've got hormones and the immune system tag teaming like they're auditioning for a WWE match. This explains why flare ups can track with hormonal shifts, why symptoms can fluctuate, and why treatments that touch hormone pathways sometimes help and sometimes, well, they don't. Here's where it gets interesting. Antihistamines and mast cell stabilizing strategies may help some people manage symptoms, especially symptoms that don't respond to typical endometriosis treatments. The article is very clear, though. These aren't a cure. They're more like turning down the volume to a very chaotic group chat. Think like the Secret Wives and Mormon Wives group chat. We all know how chaotic that's got to be. Useful, but not a pertinent solution. The bigger message, endometriosis is systemic. It affects the entire body, not just reproductive organs. That's why patients often report gut problems, joint pain, chronic fatigue, dizziness, bladder irritability, food sensitivities, you name it. And because endometriosis overlaps with immune related conditions like EDS, MCAS, POTS, and autoimmune disorders, the whole picture gets a bit more complicated. The article basically says you're not imagining your symptoms. You're not being dramatic. Your biology is interconnected. So these pieces tie everything together by exploring how hormones, inflammation, and mast cells work together to create systems many people with endometriosis experience. It doesn't claim mast cells cause endometriosis, but it does show why calming them down might help some people feel better, and why the full body symptoms make far more sense than many doctors have realized. And finally, for those of us looking into non opioid ways to manage our pain and inflammation, hi, it's me. This article is genuinely exciting. Let's talk about tirzepatide, the dual GLP-1 GIP drug that's been making waves for weight loss and metabolic health, but from a slightly different angle today. Inflammation. Because reducing inflammation isn't just about feeling less puffy, it can also help with pain, long-term health, and maybe even chronic illness management. And yes, there's a systemic review and meta-analysis on exactly this. A paper published in 2025 titled Anti-Inflammatory Effects of Tirzepatide, a Systemic Review and Meta-Analysis, looked at 7 randomized clinical trials plus an observational study to see how tirzepatide affects inflammatory markers, especially HSCRP, high sensitivity C reactive protein, and IL-6 interleukin 6. They ran a meta-analysis, which means they pooled data from multiple studies to get a clearer picture. The results? Tirzepatide use was associated with a significant drop in both the HCRP and IL-6, and excitingly, this wasn't limited to just one dose. They saw reactions across 5 milligrams, 10 milligrams, 15 milligram doses. Why is this so cool, you might ask? Well, lower CRP and IL-6 suggest that tirzepatide might be helping calm chronic low-grade inflammation, the kind that's often behind a lot of long term pain, metabolic dysfunction, or inflammatory conditions. And because the effect showed up across multiple studies and doses, it's not just a fluke. For people looking for non opioid ways to reduce inflammation, therefore pain, this adds a promising piece to the puzzle. But, yes, there's a but. The majority of this data is still from clinical trials, primarily set up for metabolic outcomes, not inflammation or pain. So, this isn't the same as a dedicated anti inflammatory trial. Reductions in biomarkers are encouraging, but they don't always translate to real world symptom relief, like pain, joint ache, or fatigue. Lower markers equal good, but feeling better, that's the real test. Not everyone tolerates tirzepatide well. We know from other meta analyses that gastrointestinal side effects, nausea, vomiting, and diarrhea, are common. There might also be long term safety concerns or on scene effects when using tirzepatide in context other than its primary indication, especially if you're using it off label for inflammation or pain reduction. Bottom line, tirzepatide is showing real promise as an anti inflammatory tool, not just a metabolic or weight loss drug. For people exploring non opioid ways to manage pain, this is a hopeful development, but it's not a magic bullet. More research is needed that's specifically designed to test inflammation and symptom outcomes, not just lab values. And if someone is considering tirzepatide for inflammation or pain, it's absolutely worth discussing with a knowledgeable provider to weigh the benefits and risks of their specific context. If there's one message I want you to take from all of this, it's that you are not too complicated. Your symptoms are not random. Your pain is not exaggerated. Your experience is not just in your head. Endometriosis interacts with connective tissue, the immune system, hormones, the nervous system, and yes, even medication developed for those conditions. Your body is an ecosystem, not a set of isolated parts. These articles collectively help us understand the bigger picture. Hope isn't about oversimplifying. Hope is about finally seeing the complexity clearly. I hope this episode has brought to light some things that could really help you. And if you know someone else that is struggling, I encourage you to share this episode with them as well. Comment your own experience so that others don't feel alone. And keep advocating for yourself. Your symptoms deserve curiosity, not dismissal. Here at Endo Battery, you always have a seat at the table, a place to feel seen, and a community ready to recharge you. So until next time, continue advocating for you and for others.